I am a professor of gynecologic oncology, and I am the program leader for cancer control and prevention. So currently we have several options for cervical cancer prevention. First, we think about pap smears, women going to their doctor to get a pap test, and that occurs starting at age 21. We don't recommend paps younger than that because the risk for cervical cancer is so low that it actually often can lead to over-treatment of things that would normally go away on their own. After age 30, we currently have a recommended co-test as the preferred prevention method. So that means getting a pap test and an HPV test, and that can be done every 3 to 5 years. And the HPV test is such an important addition to the pap test because a pap test alone is only a 60% chance that all is well. That seems pretty low, but we have to remember that the pap test was invented in 1940 something and has been around for a really long time. The HPV test, it's like changing from your rotary dial phone to your iPhone. So the HPV test is 21st century DNA evaluation to see if there's any level of HPV that could be consistent with a precancer or cancer. And so a positive HPV test really encourages the doctor to look further and to make sure that there's not anything else going on. So if you have both the pap test and HPV test together, you're more likely to catch something early before it becomes a cancer. And then lastly, we have HPV vaccines as the best way to prevent cancer in future generations. So we think that cervical cancer is pretty low because only about 14,000 women in the United States get cervical cancer every year. And that is significantly less than numbers of breast cancer. But that's because we're doing a really good job of preventing invasive cervical cancer. Actually, over 300,000 women every year get cervical pre-cancer, meaning they have an abnormal pap, they're found to have atypical cells that if left alone could turn into cancer. So when we put those numbers together, when you combine pre-cancer and cancer, cervical cancer outnumbers breast cancer in number of cases in the United States. I wish I could say that cervical cancer was easy to treat, but it's not. So for most women, a treatment of invasive cervical cancer will affect their fertility. And unfortunately, 30% of women diagnosed with cervical cancer, even early stage cervical cancer, will die from it. So current treatment recommendations is often for a hysterectomy that occurs with or without some type of chemotherapy or even radiation treatments. For women with advanced cancer, really radiation treatment is the only option. HPV vaccination is recommended for boys and girls because boys get HPV-related cancers also. So the ones we think about that are kind of the similar ones to cervical, like penile and outside skin cancers, as well as anal cancer for both men and women. But more importantly, men get oropharyngeal cancer. And this is more common in men in their 50s and 60s. It's higher in white men than in other races, and it's on the rise. It's one of the few cancers that's still increasing. There's no screening test for it. It's often diagnosed at stage 2 or later. HPV is incredibly common. It is the most common viral illness in the United States currently. It's more common than the flu. It's more common than the common cold. 80 million people in the United States are currently infected with an HPV virus of some type. To put that in perspective, that's 45% of men and 40% of women. Right. That number is very high. And when we think about a cancer-causing type, it's 25% of men. 1 out of every 4 men is currently infected with a cancer-causing HPV virus, and 1 out of every 5 women is currently infected with an HPV that can cause cancer. So there is, as we talked about, an HPV test that's recommended for women as part of routine screening for cervical cancer. There is not an FDA-approved test for HPV in men. They have done some HPV testing in clinical trials, and some specific populations are recommended for things like anal pap test among men, but it is a very uncommon test in men. We simply wait for cancer to occur and diagnose it, which is why prevention has to be the key. I wish I could tell you I knew why it wasn't an easy decision for a parent to get the HPV vaccine. The first thing I will say is that I think people are suspicious of something when it's new, and it can take a while for it to catch on. So here we are, 10 years later, 200 million doses given around the world, and still in the United States, the rates of HPV vaccination are about 60% in girls and 40% in boys, which is well below rates in the 90s and high 90s in other countries around the world, including countries like Rwanda, which have universal vaccination and have rates of HPV vaccination of 98%. So we need to do better. I think the first thing that parents want to hear is that the physician is really behind the vaccine, that they know that it's important, and it's an important point for cancer prevention. I think we have some work to do to make sure our pediatricians understand how common HPV is and how common cancers from HPV can be. And second, we need to make sure that both the physicians and the parents feel very comfortable that the vaccine is safe. And the vaccine is absolutely safe. It's one of the safest vaccines on the market today, and it's been extensively tested. So now that we have those two things under our belt, it really is making sure the parents understand that just like every other choice to vaccinate their child for tetanus, diphtheria, meningitis, all of those things being incredibly rare, of course you would also vaccinate your child against a virus that's incredibly common and can cause cancer, the thing that we're all scared about. I think most physicians are supportive of the vaccine. I think it's pretty unusual to find a physician who doesn't agree with the vaccine, and frankly, those physicians are often underinformed or even not part of the mainstream medical community. But what we find is that physicians may say, oh, we can wait a year or two. And I think there's two important points that the CDC is really trying to make sure that we make the public aware of. First, that there's a real advantage to getting vaccinated under the age of 15, that you can receive only 2 shots instead of 3 to get full protection, and that the body's immune response is a lot stronger if you're vaccinated early. I think parents and pediatricians are often thinking, gosh, if I wait until the later teens, then maybe it's a little bit easier to talk about sex. And I would say to everyone, the word sex does not have to come into the conversation about HPV at all. Just as you and I have not even mentioned sex when we're talking about the HPV vaccine, does not need to be an important component of discussing the vaccine with a child. We don't talk about rusty nails when we talk about the tetanus vaccine, and we don't talk about dirty needles when we talk about the Hep B vaccine. In the same way, we don't need to talk about sex when we talk about HPV vaccine. We only need to talk about cancer. The HPV vaccine is the most effective vaccine available on the market, and I say that hands down. Individual protection for the HPV vaccine is 98 to 99%, as long as you get it early enough to be fully protected. The problem is other vaccines are not as effective. They're more like 80, 85% effective, which is why it requires the entire population to be vaccinated to protect the child. The nice thing is, even if we don't get to that 80%, what we call herd immunity, where the entire population is protected, the individual protection, your child can be protected the day they receive the vaccine.